So these are, we wrote down some highlights of information that people have given us during the past advisory committees and consultations. So these are things that people have said are important to know, or we should consider, or that things that they find are needs in their community. So the first one here is like a drop-in option at kind available for peer support. So people are saying that, maybe I don't need to be matched with somebody because like I already have friends who like have started hormones for whatever reason or what have you. I don't need like an intentional match, but like maybe one Tuesday I'll be super sad that my doctor misgendered me or like made some gross assumption about my personality and I just want to talk about it. So having that option there just in case things go wrong or in case you're having a hard time, it's there to support you. We need to have clear policies for handling out of scope tasks and requests. So, earlier we talked about people who are undocumented, maybe wanting to access some type of translated care. Like we can't help you fill out like a application for refugee status, but we should know before someone asks that question how we would go about answering it, or we have an idea of, or volunteers and staff need to know what to say and how to say it when there's something that people need that we just can't provide for whatever reason. So that way it's clear and like everyone's on the same page. There's no confusion about like, wait, but I thought you could do this, but like this person said that you could do that, but like when I came on Thursday, like she said no. So we want to avoid that. We want things to be as clear as possible. We talked about having conversations around suicidality. So a lot of times when people are suicidal, and it's a lot because trans people tend to be suicidal because we're sad. There's a lot of fear sometimes about being hospitalized and feeling as though that can be more traumatizing for people than if they didn't go to hospital. So we need to have conversations about how we're going to handle suicidality. Like if someone is suicidal, what are we going to do? We're not calling if we don't want to call the police or like emergency services, how are we going to handle that? What is that going to look like? How are we going to incorporate the individual who is suicidal in that and not just like force something upon them that they don't want? Despite all these despite the fact that we're here to support people, we want to make sure that the community doesn't feel isolated in their problems. We have to, be realistic with the fact that we can't necessarily provide a crisis intervention program. So I don't know if you've heard of the Mobile Crisis Unit in Ottawa, but basically, it's their job to handle crisis situations. So that's their every day they're handling high stress, really complex crisis situations, and it requires a very specific type of training and personality and skills that peer supporters might not have. Not because they're bad people or because they don't know what they're talking about, but because that type of stuff takes time to build. And if you're just volunteering 6 hours a month or something, you're not going to get to the level that you need to feel secure in your role and also to support other people. So being open about that and being honest and letting folks know where they can go if they need more constant crisis intervention. So we need support for older adults. So sometimes, there's a lot of youth in Ottawa, and that's cool. Youth are awesome. I'm a youth myself, so whatever. But older trans folks also need support. They also need programs specifically for them. People need to think about the issues that older trans folks are facing that maybe younger folks are not. So so making sure that we're being inclusive of people who are over 40, for instance. So what is community knowledge? We talked about a little bit about that earlier, but trying to decide what we mean when we say community knowledge. Do we mean just trans folks, friends of trans folks, people who treat trans folks? What does it mean for community to have certain knowledge? And then at the last community advisory meeting, somebody asked about services for francophones or non-English speaking people. And so we talked about the fact that translation and having interpreters and stuff can be very expensive. It's a very lucrative business if you speak another language, get into translation. But we have a limited budget. We only got so many dollars to make this thing work at the end of the day, and so unfortunately we don't have the capacity to provide a lot of translation or interpretation. And from what we've heard from francophones and other non-English speaking people, is that certain concepts, so maybe the word non-binary doesn't exist in a certain language, or certain understandings of words are different in other languages, and so it's important to build language-specific services from the ground up. So not just like make something in English and then translate it to French, because sometimes it's like the same messaging isn't clear.
With the health navigation too, the francophone providers are gonna generally be different providers.
Yeah, you know, so like we can't accurately talk about what's going on in Quebec and like the services that you can access in Quebec if we're like not French or French-speaking people getting French services in Quebec, if that makes sense.
So we are working with francophone trans people to find ways to fund that part of the work.
Yeah, so hopefully that'll come soon, but unfortunately it's not something that we can do at this moment. But we acknowledge that it's something that needs to get done. So we move on to the next page. People talk about accompaniment to appointments and how that can be really, about how going to appointments alone can be really stressful for people. Obviously, if it's a doctor you've known for years, if your professional isn't good at listening, or you feel like they don't really understand what you're talking about, it can be stressful going to those appointments. And so having somebody there to accompany you or like go with you might be help alleviate that stress, or having somebody available to debrief before or afterwards might be cool, or like having somebody go with you to the police station to write like a police report for like transphobia that you faced, things like that. So like that buddy system and like mutual support. How do we make training intersectional? Because you know, we mentioned intersectionality as one of the values that we consider important, and so when we're looking at training for volunteers, we can't all do it ourselves. I mean, we both have knowledge and all that's cool, but we're not experts on everything. I'm not an expert on like the World Professional Association of Transgender Health. I'm not a professional, so why would I do the training on that if I don't know what I'm talking about, or at least I don't know what I'm talking about from an expert perspective. But somebody brought up that like a lot of the trainings that like people contract out to like different service providers, so like CMHA, I don't know, Distress Center, these trainings aren't intersectional. They're made for like a very specific group of people, and anybody who exists outside of that like doesn't matter. And so, yes.
Yeah.
And so how do we make training intersectional? Sky.